The coronavirus is spreading fast, and the head of the CDC says masks are the best weapon right now to help ensure the U.S. won't face an even greater public health crisis come the fall when it faces both COVID-19 and the flu. By Tuesday evening, more than 65,000 new cases had been reported nationwide, the second highest daily total of the pandemic. California, Texas, Missouri, Nevada, and Oklahoma all set single-day case records, and more than 900 coronavirus deaths were announced, including single-day records in Alabama, Utah, and Florida. Oregon matched its daily death record. The situation has become so dire, some states like Texas and Arizona, where the death toll is rising sharply, local officials are readying refrigerated morgue trucks. Meanwhile, a group of mayors in Florida warned they are running out of time to avoid another painful economic closure. CBS's Laura Podesta has the details.
CDC Director Robert Redfield says masks are key to stopping the coronavirus.
If we could get everybody to wear a mask right now, I really do think over the next 4, 6, 8 weeks, we could bring this epidemic under control.
Yesterday, Florida reported more than 9,000 new cases and a record 132 deaths. The mayor of Miami Beach wants a statewide mask mandate.
Not just urging you to do it, but it's urgent that you do it.
More than 150 employees are currently off the job at Jackson Health System after testing positive.
It's not just about having beds for patients. We also need all the support staff, physicians, nurses, and techs.
Florida is bringing in 3,000 additional nurses, but it's not the only state that needs support.
Texas is sucking in all ICU ER nurses. Arizona is getting the leftovers of that. So what does Florida get?
Hospitalizations in Texas are at a record high. The superintendent in Dallas wants to push back the start of school.
So things are getting worse. They're not getting better. And we need to have that turn around.
In an interview with CBS News, President Trump called it a mistake not to send kids back to school. A new Axios Ipsos poll found more than 7 in 10 Americans say it's risky for schools to reopen. Laura Podesta, CBS News.
In Florida, a group of mayors have raised concerns with messaging about the pandemic, which they say has been confusing and inconsistent. The warning comes as the Trump administration ordered hospitals to bypass the CDC and send all patient information to a central database in Washington. For more on this, let's bring in Dr. Nita Ogden. She is joining us now to talk about all of this. So, Dr. Ogden, one of the biggest concerns with this move by the White House is that new data will not be made available to the public. And it sort of, I'm struggling to understand the rationale behind this, why they would do this. And it's hard to not at least suspect that this has a little bit to do with politics, because these numbers keep rising. We know that, for example, in Florida, our David Begnaud, our correspondent on the ground there, has pointed out that Florida does not share all of the numbers, all of the information, and has not been transparent with the numbers when it comes to infections there. So from a medical standpoint, what kind of dangers does this pose, not having the information transparently available to the American people?
Well, good morning, and thank you for having me. Yeah, you're totally right. This was a startling mandate from the White House requiring hospitals to now bypass the CDC and report data about their COVID-19 patients directly to the Department of Health and Human Services, a database that will now be controlled by them. And people, of course, are concerned. Why? Because the White House has historically been politicizing science behind the coronavirus, and this is a very important database. This is where hospitals share what patients, how many patients they have with coronavirus, how many beds, how many ventilators. It's what we basically are using to track the pandemic, and you can see how easily that data could be manipulated or sculpted to give a certain picture of how we're faring in this fight as a nation and how it could be politicized. A lot of it, the critics of this are saying that, will we still have access to the database? Researchers, epidemiologists, they use that CDC database to make predictions and projections about the coronavirus. Will there be transparency? I mean, there's some concern that it's not going to be public, this database. So there are a lot of issues here, again, speaking to how this administration has politicized science and undermined health experts and the CDC. And that's a big concern here as we try to reopen our country.
You know, when it comes to doctors, you have the ability to read a study, understand what it means. You can sort of independently determine whether a study is valid or not. But for the rest of us, we depend on the CDC or the administration or some voice of authority to distill all of this stuff for us. Are you concerned that, you know, with this kind of open criticism of the CDC, downplaying the CDC, in some cases sort of muzzling what they have to say, or at least that's the way it appears on the outside, that people, non-medical people, are just going to just basically disregard any medical information that they get about this virus because it's just too difficult to determine what a credible source is?
Yeah, I am absolutely concerned about that. I think when the White House and people in leadership positions start criticizing our national health experts, it really puts in doubt what kind of information that we're getting from them. And these are our health experts who have had the education behind them to actually read the information that's coming out in the studies, distill that to the population. If their credibility is put in question, then what does the population really have to gather that information? We already see people are being skeptical of science, skeptical of the vaccine, saying that they won't get it. About a third of Americans, last month, Dr. Fauci talked about how if that many Americans are saying they won't be vaccinated, we won't achieve herd immunity. So there's sadly that kind of polarization happening in this country between the government and science, whereas we see in other countries that have successfully controlled the virus, really it's our health leaders who are in charge of the messaging and are in charge of these mandates about what we should do with masks and so forth. And it really isn't in the hands of political leaders. So I think it's an unfortunate circumstance, and I hope that it doesn't continue this type of trend.
Dr. Ogden, if it does continue, are you at all worried, given how shambolic this pandemic has been for this country versus others, that if there is a vaccine, that it will be difficult at best to get it to the people who need it, that some people may not want to be vaccinated because they're not sure who to trust? Should they trust our leaders? Should they trust our health officials? And that given the fact that today we're seeing, long waits for testing, which as Anne-Marie pointed out yesterday during another discussion that we had with a doctor, when somebody says, well, 7 days isn't that long to wait for a test, but that's 7 days where you don't know what you're doing. And let's say you're going to work, you're an essential worker, you could potentially be spreading the coronavirus if you are unaware that you've been infected. So that's why getting the testing results back quickly is so important, and we're not able to do that in certain states. So do you foresee, as we head into the flu season and we're still dealing with the pandemic, that even if a vaccine were to be made available, and that would be a record time to get one out, that we could still be facing serious problems?
Absolutely. And I think that hand in hand with the vaccine is going to be public education. We need millions and billions of dollars to, infiltrate our communities and educate people on what this vaccine means. Unfortunately, we keep hearing about, most recently, even yesterday, these phase 1 trials came out about the data for the phase 1 trial of the Moderna vaccine came out. And there's always this language of, cautious optimism, because frankly, we need to finish those phase 3 trials before we can see how safe and effective these vaccines are. But you see the public take away just this negative message of like, well, it's not going to work. We need more public education so that people can understand how many phases the vaccine goes through to become effective, how it really will work in our communities. Just because it might not be 100% effective, it might lead to milder disease. We even see this with the flu vaccine. So such a huge critical part of this is going to be public health education, in part to kind of negate the negative message that we get from non-scientists who are leading this country, unfortunately, and mixing up that messaging about everything from masks to the vaccine.
So, Doctor, you actually touched on some of the big medical news that came out yesterday. It was breaking news yesterday about a possible vaccine in which 45 people who had taken the vaccine had an immune response. So this is a really big deal. Now they're going to take it to the next level. What can you tell us about this vaccine?
So this was the phase 1 trial of the Moderna vaccine and RNA vaccine. And it is very, very exciting news that all 45 participants of the phase 1 trial developed a robust immune response. What does that mean? They developed neutralizing antibodies. Those are the antibodies to the spike protein so that the virus can't enter the cell. And they developed it at levels that were higher than what we see in people who had convalescent sera, which means that they've had the coronavirus and recovered. So these antibody levels were higher, and that's important. They also noted that more than half of participants did have side effects that were mild and kind of like a flu-like syndrome. And the important thing is now they're starting at the end of July, the phase 3 trial of approximately 30,000 participants. They're going to look at it in a wider age range so that we can see the ongoing studies with the older population who we know are more vulnerable to COVID-19. The big question is how durable is this immune response? So people have to be patient with that because these participants are going to be followed for the coming year. We need to see what happens when they get re-exposed to coronavirus. We don't have that kind of data yet. We keep hearing about antibodies going down or diminishing. Well, what really happens to people who have had the coronavirus and are re-exposed? That is going to be interesting to see. This preliminary data is definitely exciting, but again, cautious optimism until we have completed all 3 phases, which is predicted to be done by the end of this year.
All right, Dr. Nita Ogden, always great to have you. Thank you so much for providing that illuminating analysis of where we are. We appreciate it.
Thanks for having me.